Hello, everybody. Good to see you all here for this seminar, which we arranged a little bit out of the blue, I have to say. At some stage, Joe said he would be coming here, and then Hugo Gomez was also going to be here, and so we thought that it's very interesting. Two former PhD students of the institute can be here, and so Joe and I had a conversation, and we thought, well, it would be exciting and interesting if Joe was able to give us a talk about the work that he's currently working on, and so this is why we're here together. But there is not often opportunities to hear about the work that Joe is doing, basically at the other end of the world, and I'll come back to this in a minute. Joe is currently the director of the Human Development and Violence Research Center and professor of the postgraduate program in epidemiology at the Federal University of Pelotas in Brazil. So I remember, where on earth is Pelotas? And I've been there, and I'll tell you, this is really at the end of the world. So Brazil itself is quite far away. So you get to Sao Paulo, and then from Sao Paulo, there is another flight to Belo Horizonte. But then from there, it's an endless trek through the Pampas until you end up being in Pelotas, which is important. It's interesting, but it's important for anybody who wants to do a longitudinal study. Because what this means is that this city of about 350,000 people that Joe will talk about in every longitudinal study you're concerned about attrition, people moving elsewhere and you don't find them anymore. But in Pelotas, they just stay where they are. And that's a very good thing for a longitudinal study. He previously was, I already mentioned this, PhD student and then postdoc at the Institute of Criminology at the Department of Psychiatry at the University of Cambridge. He was doing his PhD, for which he is very well known, together with David, on the effects of imprisonment on the children, of the imprisonment of parents on child development. And if you read something on child development of people of parents who are in prison, that's research that very much pioneered and developed and made an important topic in criminology. At the moment, main projects of his work is really on the life course determinants of prevention of violence in 4 birth cohort studies that followed 20,000 families and children in Brazil. Joe received as for the MPhil students and the PhD students, he received the Manuel Lopez Rey Prize and the Nigel Walker Prize in Criminology here. Also the Distinguished New Scholar Award from the American Sociology of Criminology, the Division of Corrections and Sentencing, in connection with his work on the effects of imprisonment. And he's held fellowships with the British Academy, the Darwin College, where he was a fellow, and the Wellcome Trust. And he currently holds an investigator grant with the Wellcome Trust and a high productive researcher award. This sounds amazing. That high productive researcher award, pesquisador de productividade. So it's great to have Joe here, and I hand over to you. I hope, before I hand over to Joe, we have, I can't see the numbers here. We have quite a few people who are joining online. I don't think they can communicate with me. Rebecca, do they effectively see?
They can see, and they can use the Q&A.
And they can use the Q&A. So this is,
have audio.
okay. So this is what I just wanted to say. After Joe's presentation, there will be questions and a discussion. Those of us who join online, please use Q&A. Post your questions there. I will monitor the Q&A while Joe is talking, and then we will make sure that the questions that come in from the remote participants can be joined with the audience here, and we have an interesting discussion. Thank you very much, and over to you, Joe. Oh.
Thank you, Manuel. Thank you all for coming. It's a huge pleasure for me to be back here. Despite that, I did my MPhil here and some postdoc work, but it was actually a long time ago. It's about 15 years, and I've gone through all sorts of different places since then, but still feel this is kind of my intellectual home. And so I'm very happy to be talking about work I've been doing recently to you all. As Manuel said, we'll be talking about cohort studies, another word for longitudinal studies that are in Pelotas in Brazil, this far off place. Addressing the question in the title about developmental criminology. In a country like Brazil, which has very high levels of violence, whether this approach to thinking about child development and supporting child development that has been, so successful elsewhere, and David Farrington here has been one of the kind of most important figures in that field, whether it can help in such a different context. But first of all, I thought I'd show you, so start with some maps, nice to look at. Got three, they're all quite old, but they're still, the basic truths are still there. Well, world land area doesn't change much. The next map shows countries in the world distorted in size according to certain characteristics. So that's where most of the world's population lives, the huge bulge of India and China. And then we can look at a third map about the number of homicides per country. And we just get this enormously different picture with these huge bulges in South America and sub-Saharan Africa in particular. So this picture calls out for research in these areas which have such a great problem of violence. But as I'll go on to talk about, most of developmental criminology has happened elsewhere. And so it's a big question. In theories, the same results will be found in these other contexts, and whether the same prevention programs might be useful there. So in this talk, this talk has three parts. First, I'll just briefly say what developmental criminology is for anyone who isn't familiar, and then talk about these longitudinal cohort studies in Pelotas and Brazil, with picking out three findings for you. First of all, on the relationship between children's behavior problems and their later violent behavior, looking at early risk factors for conduct problems and behavior problems amongst children. And then thirdly, about the influence of poverty, a crucial issue for violence and crime, but looking at it very much through the life course and thinking about whether poverty early on or later in the life course is more important for understanding violence in this context. So that's the main package, and what I'm most keen to share with you as a kind of taster for the work we're doing in this with these. And then thirdly, I'll go on to mostly speculate about future work that might be useful to think about linking macro and micro mechanisms. So what is developmental criminology? For most of you, this is well known, but I think we can just think about developmental criminology as essentially following people through their lives and trying to understand what are the causes of why some people become violent, some people don't, or involved in crime or not, and why that changes through time as well, why people are involved in crime and violence at some points and not others. And ideally, we're wanting to truly know about causes, not what we can call, and are often research, risk factors, and ones that could be modified early on to prevent later crime and violence. So studies tend to look through a range of individual factors about children themselves, their family environment, schools, peers, and in their community. There are different theories about how a child might develop through their life course, way that explains later crime. There's a number I could pick from, but just one of the most influential theories is Terry Moffat's theory. Different types of offenders, with a lot of attention that's been given to her theory of life course persistent offending, which she believes is caused by an interaction early on in life between children with vulnerabilities, neuropsychological difficulties, growing up in a stressful and difficult environment, and the kind of behavior problems that emerge early on from difficult parent-child interactions, and this leading to a kind of cascade of problems going into teenage years. So these behavior problems can persist and increase in severity towards crime and violence later on. So this kind of picture is extremely interesting and compelling. I remember as a student being fascinated by this kind of vision of understanding early roots of crime and violence, with therefore obviously the capacity to think about prevention from early on and developing a support system to try to steer children into more positive development and better trajectories through the life course. And of course, there have been some examples of very successful interventions in this kind of way. To take one famous example, the nurse home visiting program developed by David Olds in the States, which organized home visits by nurses to disadvantaged mothers given between pregnancy and age 2 years, in order to support mothers to give care to children, to support healthy behaviors, and support mothers themselves in terms of their life course development. So this program, which was developed some decades ago, then was tested in several randomized controlled trials, and the results were striking from this intervention. So it's cited as one of the few early interventions that has a preventive effect on children themselves being exposed to violence and child maltreatment, a reduction of nearly half the risk of children experiencing maltreatment up to age 15 in the Elmira trial, as well as showing that those families who received this intervention compared to the control group had children who were much less likely to be involved in delinquency as well. So as I said, it's a very inspiring kind of vision where we can think supporting families to promote positive child development and reduce later crime and violence. So coming back to this main theme of the talk is the problem of where the evidence comes from that this is a useful approach. David Farrington and Brandon Welsh wrote a book in 2007 kind of compiling all the evidence from these longitudinal studies as well as the experimental studies on which interventions were. And you can see that the kind of basic science on the longitudinal predictors of crime, at that time they listed 30 major cohort studies of crime. And you can see here that they were basically all in high-income countries. That's all except one, Mauritius, which is not a high-income country, but it's also not a high-violence country. In fact, rates of violence there are relatively low. So there's a huge gap here between where the evidence is and where the largest problems lie. Some years later, we did a systematic review to try to identify other longitudinal studies that looked at violence. And Manuel and I wrote this up with a team. It was a big team. It was an enormous project. We searched in 7 languages, screened 70,000 articles, and we did locate a total of 7 longitudinal studies that have looked at any association between an earlier kind of risk factor and later perpetration of violence. It has to be said that a few of them were really not focused on violence at all and reported just kind of 1 or 2 associations, and 1 or 2 were just focused on intimate partner violence. But what I'm going to bring to you today, you can see a couple of studies here. We've done quite a lot of work on this issue, so I'm going to bring you some findings from there. A little bit more about Brazil. The size of the problem is hard to emphasize effectively, but in 1 year, 2018, there were 57,000 homicides. That's more than 1,000 every week in Brazil. And if you count all of the homicides that have occurred over the last 2 decades, that's over 1 million people have lost their lives to interpersonal violence in that time. And in fact, today, homicide is the leading cause of death amongst young people in the whole of Latin America, well, in large part driven by Brazil's levels. So this is just an enormous problem. And that's where I went from here, and back around 15 years ago. So a lot of colleagues joke that, yes, follow the crime. I will say personally, actually, this was motivated by love. My wife is from Brazil. Nonetheless, it's been a fascinating place to work professionally. As well as violence, Brazil has had major health issues, has had very high infant mortality rates, for example, that have been steadily brought down for the last decades. But there's also recognized a major challenge, not only just to stay alive, but to thrive as children. And so there's increasing emphasis on trying to support positive child development, and those the kind of rates of children who are developing below their potential starting to come down. You can see here, but there's still a long way to go. So I think you can start to pose the question in this environment. Would working on child development, helping children to develop psychologically, cognitively, socio-emotionally, would that help reduce the other problem in Brazil of high rates of violence? Let's just think a little bit about other characteristics of Brazil. So you may well have seen or even been to Brazil as a tourist, and it's certainly got some staggering images of beauty. So a wonderful people. I love living there. There's many things going for it, but some of the key characteristics that I'd just like to highlight here. First of all, deep levels of inequality. You can kind of get a sense of that from this photo. But it's really staggering, the although it's actually a high upper middle income country now, but the levels of inequality that reflects means that there are vast swathes of the population that are deeply poor still. This is a country that was in dictatorship until 1988, and so has been transitioning into democracy with challenges along the way. I've talked about the level of homicide in Brazil. It's critically important to recognize other types of violence and violence by other actors. So here I show the number of police killings in 2019, 5,000. Now that number related to a rate per 100,000, which is about 1, is similar to the rate of murders in the UK, for example. So police are committing as many killings as, for example, murderers in the UK. And the conflicts that develop between gangs and police in Brazil is amazing. Another point to note is the number of prisoners is 750,000 at the moment in Brazil, but in terrible conditions. And in fact, a lot of the criminological work in Brazil is focused on the issues of drug gangs having developed and organized from prisons and then taken an organization out into the community where violence has erupted. So just pause for a second and just consider whether you could imagine early parenting programs supporting young children could, in this kind of context, potentially reduce violence substantially, or whether these kind of large-scale societal difficulties may mean that gets you nowhere. I think this is a real question to be asked. So in asking that question, I think we can pose a few sub-questions. First of all, if you do the kind of longitudinal research that's been done in high-income countries, do we see developmental factors associating with this end point of violent behavior in this context? Or does it swamp any of the individual level influences that have been hypothesized? Even if there are important developmental influences on violence in that context, there's another more practical question where the kind of interventions that have been developed elsewhere are suitable for Brazil. So it's something I'd love to talk about more, but it won't fit in this talk. So I'll just mention now on this point 3 that there's a real problem about the costs of the interventions that have been tested over and over, like the nurse-family partnership, for example. I had a colleague who looked at testing that in Brazil as well. It became immediately clear this was totally unrealistic. There are huge costs involved. This is a company you have to pay a license fee to get training. You need highly trained nurses who are less available in this context. So it's a very interesting movement by the WHO to promote much lower cost interventions in low middle income countries. But it's still not clear whether when you reduce the cost of them, and we've been conducting a trial or two where they're shorter, they're group-based, they don't involve such highly trained professionals, whether they'll really have the same effects. So I just kind of leave that as another point that needs thinking about in this debate. And come on to the observational studies that we've been doing, as Manuel said, at the end of the world, or the end of Brazil anyway. So there's Pelotas, right as far south as you can go, just next to Uruguay, in the state of Rio Grande do Sul. So Pelotas is a medium-sized town in Brazil, a population of about 320,000. The south of Brazil is richer than the north of Brazil, but Pelotas is relatively poor for the south. It's got quite a mix to it of both being quite a beautiful place to live in. It's got some lovely historical buildings, a beautiful lake or lagoon, but also, as I referred to in terms of inequality, some quite serious poverty as well. So in Pelotas, there are 4 birth cohort studies, 4 studies that have followed children since they were born as they've grown up. And these were set up by 2 incredible researchers, Fernando Barros and César Victor, from the 1980s. So I'm going to explain now the overall sort of methodology of these cohort studies, and then take you into a few of the findings about predictors of violence. So the first one was set up in 1982 when Fernando Barros was doing his, he's an epidemiologist doing his PhD in London, and decided to monitor all the birds in the city of Pelotas in 1982 to examine maternal and infant health. Now, in Pelotas, over 99% of children are born in hospitals. And so what he did is he had a team of undergraduate medical students stationed in the hospitals, monitoring from 1st January to the end of December who was born. And happily, over 99% of the mothers of the children agreed to participate in this study. And that gave a total sample of 5,914 children who were born in that year. Basically, all the children born in Pelotas in that year recruited into the study. It wasn't intended at first as a longitudinal study following these children, but it soon turned into one when César Victor joined Fernando Barros. And since 1982 has developed into this picture where on the top you see the ages at which that first cohort were seen at birth, age 1, 2, 4, and on into adulthood, with the last visit or assessment made when they were age 30, with 68% of those original children, and we're currently assessing them now again at age 40. That study had a huge impact. These are really incredible researchers who've done this, and it's a broad epidemiology study, had very important results, changed policies on breastfeeding and other issues. And so what happened was, as it had been so successful, 11 years later, a new study was set up in 1993 to do exactly the same thing, to see in 1993, take all the newborn children, what's their health like, what's maternal health like, and another longitudinal cohort study was launched in 1993, all children born in Pelotas, and followed from there on. And this happened every 11 years, so that in 2004 and 2015, new cohort studies were started. So this gives you data about people as they grow up, but it also gives you data about the changes at the level of the city through time and at different ages. So it's just an incredible resource, very famous internationally in the field of epidemiology. And in 2010, I proposed that we integrate measures of violence and determine possible determinants of violence into these studies. So I've been working on it since then, and currently I'm co-directing the youngest cohort, the 2015 cohort, to have as many early measures I think are relevant as possible. So through this time, there's been a big sort of shift in the way the research is done, from the early assessments made only in people's home, pen and paper, to now when an entire building there on the right has been built just to assess these cohort participants. So we just have daily 20 to 30 participants coming into this building for very detailed examinations. As I say, it's a very broad epidemiological study, so a huge range of physical and psychological and social data collected with all sorts of measures. Throughout this time of these studies, this is what happened to the rate of homicide in the city. So in 1980, homicides in Pelotas city were lower than Brazil as a whole. In fact, they're about the same as the rates in the UK today, 1 per 100,000 a year. So since then, that has got 30 times worse. And so you can see that this is just an incredible growth in the rates of homicide through time, with each cohort being exposed to different levels of serious violence in the community as they grow. So it was in this context that I went to Pelotas and set up a group there to look at different issues about the consequences of exposure to violence on children, on their health, about these time trends and how we can understand them. We've run a number of evaluations of interventions, but what I'm going to talk to you about today is what we've looked at in terms of possible determinants through the life course of later violent behaviour. So the first thing, the first results I want to show you are quite simple. Just going to ask the question, in this context, if you measure children's behaviour and their conduct problem behaviour, lying, aggressive behaviour that are symptoms of conduct disorder, which in nearly every longitudinal study I know in high-income countries is related to later crime and violence. Do we have the same association in this context? If not, that would suggest, well, perhaps forget about developmental interventions. We've just got to think about the endpoint more. So we looked at this in the 1993 Pelotas cohort that was born in 1993, but also in a cohort extremely well matched in England called Alsbach. So this is a cohort study of children born around Bristol in the Avon area in the early 1990s as well. And Alsbach had happened to have collected the same measure of children's conduct problems when they're age 11. And also they'd introduced a measure of self-report measure of criminal behavior at age 18, which is one that I took to Pelotas. We did a lot of fieldwork tests of it and then applied in the 1993 cohort. So first of all, I just want to show the rates of self-reported violence at age 18 in the last 12 months by men and women in Alsbach. So you can see the expected sex difference there, with men in Alsbach in Britain self-reporting 11% versus 3% in women. So when we look at Pelotas, the self-reported rate of violence is also higher in men than women, and kind of doubly so comparing Pelotas to Alsbach men, and an even larger ratio for women. So this kind of confirms what we tend to see from official records, with more violence in this population in Pelotas, but so it's confirming it in self-reports. Now, what about if we go to the data further back, which was collected at age 11 with maternal reports on children's behaviour. So on the x-axis here, you see the score given on the Strengths and Difficulties questionnaire about children's conduct problems by the mum, with higher scores meaning more conduct problems. And this shows that in Ausbach, in Britain, as children had more conduct problems, their probability of self-reporting violence 7 years later increased. In Pilotus, let's have a look. So we have the association that would be expected, that more conduct problems earlier on predict higher self-reports of violence at age 18. But it's also notable that if you take just one kind of level of conduct problems, this bar on the left, the lowest level of conduct problems, 0 to 1, at age 11. At the same level of conduct problems, we see more violence self-reported in Pilotus. So it's not all about children's earlier conduct problems. Something else is going on in explaining the higher rates in Pilotus. Okay, so that's the kind of first part of this picture, very basic one. I just want to clarify that there is that association, and leading us to think, well, the conduct problems, early behavior problems, if we could understand them and we could support children to have different trajectories early on, more positive development of social skills and so on, then potentially that could then kick into less violence afterwards. So what do we know about what predicts children's conduct problems in this context? Do we get similar results as all these other studies for many years have shown in high-income countries? So for answering that question, I'm turning to the Pilotus cohort that was born in 2004, because they had richer data than the older cohorts on a number of psychosocial variables early on that you'd expect to be important. This cohort also had repeated measures of children's conduct problems. So between ages 4 years to 15, they were repeatedly had repeated assessments of their level of conduct problems, and that enables you to look at their trajectories and outcome quite similar shapes of trajectories, at least as we've seen many other studies, with one group of children who already have high levels of behavioral difficulties very early in life and kind of are persisting through at least to adolescence, while others remain low and some are increasing into the adolescent period. So what Thais did was to take a number of possible risk factors that may just predict these different trajectories of conduct problems, and kind of group them by ecological level. So looking across socio-demographic kind of characteristics of the family, but some prenatal exposures, maternal mental health, some parenting characteristics that were measured, childhood exposure to trauma, and some child neuropsychological tests that were done. And I've put in bold here the variables that were measured early, before age 6, and predicted these different trajectories. And in particular, I've given the odds ratio, the effect size showing how strongly the risk factor was associated with either being in that trajectory that's had early onset and persistent conduct problems versus the low group. And so you can see here that a number of these risk factors were significant and quite strongly associated with persistent behavioral problem trajectory. This recently was published and shared this with Terry Moffat, this just looks exactly like our Dunedin study. These tables could have come from that. So far, looking at all this, we're not seeing very different kind of results, even in this very different social context, according to multiple levels of different influence on children's behavior, and knowing that children's behavior is, at least to some degrees, behavior problems associated with later violence. So I'm not going to talk about it a lot now, but if you'd like to see, but also looked at a number of these earlier factors in relation to violence itself in the 93 cohort from some factors which had quite weak associations with later violence. Hyperactivity and inattention, which was strongly associated. I was amazed when I saw this classic risk factor of low resting heart rate in this, on the other side of the world, went and tested it, and there it was, an association with violence for males. And we've done quite a bit of work about the role of poor educational performance on children's risk for violence as well. But the third area of research that we've recently done has taken an even harder outcome of looking at criminal records in the oldest cohort. And so I'm going to show you last kind of piece of empirical findings, results on the relationship between the experience of poverty at different times growing up and the probability of having a criminal record for any violence, and actually also homicide, which we found in the study. So these are preliminary results, not published yet. And what we did when the 1982 cohort turned 30, so about 10 years ago, we went to search the criminal records of these of the 5,000 odd participants, and I've been involved in doing that to some extent in Europe before, and I just couldn't believe what a task we had on hands. We had to go to these warehouses full of paper files and code or search for 5,000–6,000 people across 5 different institutions as well, to get a full picture of any contact with the criminal justice system, with police, courts, and detention centres and prisons. And then it was a kind of manual job to bring that all together, cleaning, coding, merging. So it's literally only now that we're finally analysing these data. Hugo here is helping. And for the results I'll show you now, I'm going to look at who was recorded up to age 30 as having committed homicide or non-lethal violence. For the 5,600 people for whom we had records, there were 1,092 people who had a record as a suspect of having committed any violent offence. So that's 19% of the whole cohort. And then we looked within those violence records, and we could see that 52 people had a record as a suspect of having committed homicide. So that's around 1% of the cohort. Given they're nearly all male, that, as Manuel points out, that's 2% of this population of males had a record as a suspect of homicide. I say suspect because we're mainly using police records here, and it would be very skewed because so few crimes end up leading to a conviction to base our work on anything else. So of these homicide offenders, they committed 68 offences, and 73% of those firearm, very similar to national statistics on this. And as I said, we thought, well, let's take as our first analytic question, how poverty relates to this. And we had 3 measures of poverty that we used in these analyses: what family income was like at birth, 4 years, and when they entered young adulthood at 23 years. And you can see there was high levels of poverty defined by the Brazilian government kind of definition at the time. And you can see that decline through time. And we want to think about how poverty at each time point relates to these 2 outcomes of violence and homicide. Now, there's a kind of tricky methodological issue here, given that poverty predicts later poverty. So there's a lot of continuity, especially birth to age 4, of those who were poor at birth. The families were still 75% still poor at age 4, and so on. So there's a lot of different ways that poverty accumulate through time, be downward mobility from first having been rich to poor, and we wanted to try and tease out different ways that poverty could affect these outcomes. So before getting into more complex analyses, first ran very simple regression analyses, taking each variable of poverty at birth, age 4 and 23, and looking at the association with our 2 outcomes. So these are the odds ratios. Again, it's the strength of association with, first of all, any violence. You can see an odds ratio of about 2, no matter when poverty was measured with an outcome of any violence. When you take the outcome of homicide, you have slightly stronger associations for the variable poverty at birth, as well as poverty at age 23. But given the complexity of continuity in poverty and so on, this doesn't tell us when poverty is most important for these outcomes. And so I've had a fantastic collaborator, Michelle Degli-Sposti, who brought to this problem an modeling approach called structured life course modeling approach, which gives you a tool to exactly unpick this kind of problem. So what this method does is it asks you to give the model 5 kind of predictive variables that kind of represent different hypotheses. Okay, so you might have the hypothesis that poverty at birth is the most important aspect or timing of poverty for later violence, because that's when we have fastest acceleration in brain development and sensitivity to environmental impacts. So from a kind of very developmental point of view, either poverty at birth or age 4 might be the most important timing of poverty for later violence. Or from a very different point of view, it might be kind of current poverty in early adulthood because of difficulties of unemployment and lack of access to resources that lead someone crime and violence. Or it might be less about specific timing, it's mostly about just accumulation of poverty or downward mobility as well. So I don't know if before you see the results you have any guesses, but this is what we asked of the data. Which kind of aspect of poverty is most important? I'm not going to go into the details, and I need Michelle for a lot of the details of the modeling approach. Rather, I'll jump into the results. So what this modeling approach does is it kind of kicks out any variable out of those 5 that I mentioned that aren't really contributing to explaining the outcome. And when you look at the first outcome of any violence recorded, what we see is that the first variable of poverty that this model picks out is that cumulative count of how many times through the life the child and person was exposed to poverty. But you can see underneath the poverty at age 23 was also held in the model, and you can see that there that it's actually contributing something in addition to that cumulative count to know whether the person was poor at age 23 as well. What's missing is poverty at birth, poverty at age 4. If you adding that in, it doesn't help you in any way predict violence, any violence. And then when you look at the outcome of homicide, you can see that actually the first and foremost variable of poverty involved is that at age 23. So it had the largest association with the outcome. There was also a contribution of whether there had been cumulative poverty through the life course. But what we don't see is a contribution specifically of poverty at birth or age 4 or the measure of downward mobility. For those who kind of get interested in these things, you can kind of see what this model does, where it looks at a kind of pseudo R squared, and it picks out cumulative poverty for explaining this, and also poverty at age 23, but almost no additional explanatory power given by poverty at birth and also the other variables. And I very briefly want to link this into the fact that when we've also plotted the age prime curve in Pilotus, I'm assuming nearly all people are criminologists here, but if you're not, then the age prime curve classically has a growth into the frequency of committing crime until late teenage years, and a natural decline afterwards, and has been shown in countless studies like that. And we see something completely different in this oldest cohort, the 1982 cohort. So we're still going to unpick what this is about, different possibilities of age, cohort, period effect, but it is suggesting we need to think a lot more about this transition to adulthood and what is going on then, as well as any early developmental stuff. So just to finalize, I've just got a few speculative slides for what I'm trying to think about here and where we're going next. We kind of come back to the big picture of looking at Brazil and the characteristics of the country and what we know about just correlates of homicide rates between countries. Remember taking this list from one of Manuel's slides at some point, but countries characterized by high inequality, weak democracies, low legitimacy of the state, low social trust, investment in health and social welfare, and low human development, tend to have higher rates of serious violence. Now, how can we think about how these high-level causes, relate to when we're doing this very individual level work in cohort studies? So I would put together this slide that I'm not sure how helpful it will be, but I'm just trying to use it to help myself think a little bit. But you have these societal level determinants, and characterized very much by these different features. It's a bit odd when we think about what we're doing in this kind of developmental research, because we're looking at variation between people in Pilotus, for example, whether who has a violent outcome, who doesn't, maybe through time within an individual change. But at one level, if we think these causes at the top are important, well, everyone's in that society, right? Everyone's in this very difficult macro environment. So it can, at times it's felt a bit perverse to be working at this level and not to be doing more sociological work, which a lot of people do in an important way. I think it's going to be very interesting to try and link them up. This is my main argument. Because when we think about, okay, you've got a macro level feature like high inequality of Gini of 0.5 or whatever it is, that's experienced very differently between different people according to social structure. So of course, someone who's rich experiences high inequality in a very beneficial way compared to someone who's poor. But similarly, in relation to policing and criminal justice, which is a major problem for poorer communities who can suffer and are not protected by policing, compared to kind of richer communities who not only perhaps don't suffer the same kind of prejudices involved, but also by private security and by other kinds of healthcare and so on. So so there is variation in experiencing of this kind of macro level characteristics that are thought to drive violence. And what I'm trying to think through is that I think there's probably a way that this variation in exposure to societal determinants does then impact at the individual level through these classic developmental kind of risk factors I've mentioned, and stress in the family environment and parenting and other aspects. But I think also there's another whole kind of process going on, which that doesn't capture very well, which means people are exposed to different situational factors in their lives and have very different relationships with the social institutions of the society. So I think that's kind of how I'm trying to look at the whole picture. And what I'm most interested in doing is seeing whether we could kind of bring some of these issues into the developmental work we do, to see if that could also contribute to understanding these higher level issues. So in particular, what I'm interested in at a certain level is about moral development and how that takes place for the child in interaction with an understanding of these wider social processes. And I think that might be a kind of new and interesting area for developmental criminology, to think about from starting at a young age, how parents first perceive these wider issues themselves, and then how that may be communicated and influences children's own perceptions, and then following them through their own experiences of going out into the wider community and engaging and interacting with different social and legal institutions, and kind of building that into the kind of more classic set of risk factors that have been studied. So it was particularly why I've ended up spending a lot more of my time on the youngest cohort, the 2015 cohort, where we're trying to build in some measures to help think about these things. So just as one example here, we filmed all the kids with their mums, in this case, looking at a picture book that we kind of produced that has different scenarios in it that have conflict, may evoke conversations about different kind of moral issues, and have been coding what mothers discuss with children about these towards later trying to understand this part of development in relation to future violence. So my conclusion is, I think developmental criminology can help in this context. I think what has been found elsewhere is quite remarkable sometimes, that you get similar types of factors that associate with children's behavior problems and then their later violence, and it can help at least bring some understanding to the problem. But some results are also suggesting, like this one about poverty, where that was really young adulthood, experiencing poverty in young adulthood was more important than experiencing it early on. You know, pushes us towards thinking about this wider social context and how that's experienced, and hoping that developmental research can still can integrate some of that into its work. And the last part that, again, it's not something I've got time to go into a lot, but then the question of which interventions are actually used and which are practical and which really are effective in this context. We just still need more data to know. So thank you very much for listening.